Patricia Gibson.
Thank you, Mr Chair. And I want to begin by thanking my honourable friend from the constituency of Argyll and Bute, a constituency almost as picturesque and beautiful as my own, for bringing this important debate forward. This debate is extremely important since we have had no evaluation, independent or otherwise, of the effect of leaving the EU on the UK's health and social care sectors. And I heard what the Honourable Gentleman from Henley said before I got to my feet, but I would just say that the Royal College of Nursing have pointed out that the Brexit process is presenting new and exacerbating existing challenges around workforce, sustainability, recruitment and retention of the existing and future nursing community, and that should be of concern to everybody in this Parliament. The health and social care sector, we know, is already facing a recruitment and retention crisis for a whole host of reasons, such as poor pay, lack of recognition of the importance of the work that these people do and the professional commitment required from them, alongside the statutory and voluntary demands of a growing elderly population. We face similar challenges across the UK in this regard, but in England, the situation facing social care is absolutely critical for a variety of reasons, and that's why I'm extremely disappointed today that we have so few members from across the House from Labour and the Conservative Party. The context in which we are debating this is important, as the sector relies heavily on workers from the EU. We have no plan how we can fill the gaps that are increasingly being left. And in the wider context, I have been told in debates before that no EU workers will necessarily be forced to leave the UK post-Brexit if they have been here for a certain number of years and fulfil certain conditions, etc. But the environment that has developed, and I think this is important for the Minister, the environment that has developed means we will lose many of these workers, both in the health and social care sectors and beyond, because of the environment that has been created around Brexit. Why should these workers, any workers, stay in the UK when they can take their skill sets and their professionalism anywhere in the EU that they wish, where they will be welcomed and appreciated? Sadly, something they don't feel very often in the current UK environment. But this is deeply concerning because by 2035, it is expected in the UK we will need 650,000 social care workers simply to keep pace with rising demand. And this in a sector that is already, as we've heard from the Honourable Member for Argyll and Bute, is already facing a whole range of challenges. The challenges faced by England are well documented, but in Scotland we are not immune to these challenges. The Care Inspectorate and the Scottish Social Services Council has found that more than 38% of social care services report unfilled staff vacancies. And that's even before Brexit has actually happened. Around 104,000 of the current health and social care workforce are EU nationals, and at any one time there are around 110,000 vacancies unfilled. In addition, around 320,000 of those working in this sector are 55 years old or above, so they will be retiring in the next 10 years or so. The situation is alarming, and the strains are affecting not just our social care sector, but our entire national health services across the UK, our nurses, our doctors and our GPs. The situation could throw rural care in particular into real danger. For example, 1 in 5 of our rural GPs in Scotland is an EU national. 1 in 5. And it would seem likely that EU-qualified clinicians are already located disproportionately in hard-to-fill specialisms and/or shortage occupations such as radiology. And I would just add that medical isotopes are used to diagnose and treat cancers. In 2016-17, the NHS used radioactive materials in nearly 600,000 procedures. These medical radioisotopes have a short half-life and cannot be stockpiled, even if one was so minded to do. The Royal College of Radiology is planning for difficulties in accessing the radioactive materials by planning a lighter workload for the week following our exit date from the EU. However, that will hit patients who need and deserve treatment of their cancer. Now, I mentioned this very point in a debate in the Chamber 2 years ago, and I was jeered and I was accused of scaremongering, despite the fact that I was simply quoting the Royal College of Radiology. The jeering has stopped, but the challenges posed by Brexit are in no way receding. They are growing. So I don't have the relaxed attitude towards these challenges that the Honourable Member for Henley seemed to have. But throw into the mix the UK Government's inability to guarantee uninterrupted supplies of medicine, and the future looks grim indeed. This inevitably will affect our ability to look after the vulnerable and ill people in our communities in every single constituency, the people who need care and the people who need support. And of course, there is the wider context of our NHS services across the UK being open to predatory procurement, which again the UK Government refuses to guarantee will not happen. No evaluation of the effect of leaving the EU on the UK's health and social care sectors has been undertaken, and that's an absolute disgrace. The Government of the day has a duty to serve and protect those it seeks to represent, and there has been too little attention on this most serious, calamitous situation that awaits us, unless this Brexit madness ends, which has been characterised by confusion, incompetence, a complete breakdown of cabinet responsibility, and not just a little bit of arrogance. But those who will bear the brunt, those who will pay the price, have not featured prominently enough in this unfolding tragedy. Today their voices, their concerns are being set out clearly, and the Government should, it simply must listen and do all it can to protect our health and social care sectors upon which we all at some point will rely.